Now, if we talk about the parts of the temporal bone, there are three parts: the petrous part of the temporal bone, the squamous part of the temporal bone, and the tympanic plate of the temporal bone. The petrous part of the temporal bone, if we see the internal structure, this was the petrous part of temporal bone in the form of a mountain inside the middle, and the posterior cranial fossas. This is projected downwards between the greater wing of the sphenoid and the basi-occipit. This part here. This petrous part of the temporal bone, on its posterior surface, then is pierced by the carotid canal. Its apex is separated from the body of the sphenoid by the foramen lacerum. This foramen lacerum is bound by a number of bones. Posterolaterally, the apex of the petrous temporal. Posteromedially, it is bound by the basi-occipit. Anteromedially, it is bound by the body of the sphenoid. And anterolaterally, it is bound by this scaphoid fossa's projection downwards. Then, there is another part of the petrous part which we visualized internally, which was a plate of bone called tegmen tympani. This tegmen tympani projects inferiorly into the squamo-tympanic fissure, which is present between the squamous part and the tympanic plate, and divides this squamo-tympanic fissure into a pterotympanic and a pterosquamous fissures. The tympanic plate, we can see it on the lateral view. The tympanic plate was the plate which forms the anterior, inferior, and posterior-inferior boundaries of the external acoustic meatus. This plate in the base of the skull is triangular in shape, with its apex directed medially, just below the spine of the sphenoid. Its base is broad and roughened. Then there is the squamous part of the temporal bone. This squamous part of the temporal bone, when visualized laterally, it forms the anterior part of the mandibular fossa. This mandibular fossa houses the head of the mandible and forms temporomandibular joint. So, the squamous part forms anterior part of the mandibular fossa. Then, it has this articular tubercle at the root of the zygoma, and it forms some part of the infratemporal surface. There is only one attachment in the temporal bone, which is of the levator villi palatini, which is attached on the inferior surface of the petrous temporal bone. If we study the posterior part, which extends from an imaginary line that passes through the anterior margin of the foramen magnum, we are also going to study it in two parts, a median part and a lateral part. The median part from above backwards has the foramen magnum, the external occipital crest, which ends at the external occipital protuberance, and the knuckle lines. We are going to talk about them. The foramen magnum is the largest foramen of the body. It is continuous above with the posterior cranial fossa and below with the vertebral canal. This foramen is narrower anteriorly because of the overlap of the occipital condyles, and it is wider posteriorly. The posterior margin of the foramen magnum gives rise to a crest which is called external occipital crest, and this crest ends at the external occipital protuberance, which we have talked about. The middle of the external occipital crest gives rise to the inferior knuckle lines. The occipital protuberance gives rise to superior knuckle lines. Both of these lines project laterally and downwards. For the attachments, the anterior part of the foramen magnum gives attachment to anterior atlanto-occipital membrane. The posterior part gives attachment to posterior atlanto-occipital membrane. Alar ligaments get their origin from the medial surface of the occipital condyles. The external occipital crest gives attachment to the knuckle ligament as well as the external occipital protuberance. The lower part gives its attachment to the knuckle ligament. Then the inferior knuckle lines, between the inferior knuckle lines and the superior knuckle lines is the insertion of semi-spinalis capitis medially and superior oblique muscle laterally. The area below the inferior knuckle lines gives insertion to rectus capitis posterior minor and rectus capitis posterior major. Now if we talk about the lateral part, we have some features: the condylar part of the occipital bone, the squamous part of the occipital bone, the jugular foramen, the styloid process of the temporal bone, and the mastoid process of the temporal bone. First, looking at the condylar part, we have the occipital condyles, the right and left occipital condyles. These condyles anteriorly overlap the foramen magnum, making it narrower anteriorly. The long axis of these condyles is directed forwards and medially. They are going to form a joint which will be the atlantoaxial joint with the atlas vertebra. The occipital condyles on their anterosuperior surface have foramina which are called hypoglossal canals, here and here. These hypoglossal canals or the anterior condylar canals are present anterosuperior to the occipital condyles. Posterior part of the occipital condyles have also two canals. These canals are called just the condylar canals or posterior condylar canals. These condylar canals are present in the condylar fossa just behind the occipital condyles. Then there is a jugular process. This jugular process, it projects backwards from the occipital condyle and forms the posterior boundary of the jugular foramen. Now the squamous part. The squamous part of the occipital condyle has been discussed previously, and it has the inferior and the superior knuckle lines. There is another foramen which is called the jugular foramen, this part. If we visualize internally, this jugular foramen was the part where the sigmoid sinus opens into the internal jugular vein. This jugular foramen, viewed on the inferior aspect, has an opening, the jugular foramen, and laterally a fossa which is called jugular fossa. This jugular fossa is larger on the right side as compared to the left side, visualized here. This jugular fossa has its main component on the petrous part of the temporal bone and is bound by the jugular process of the occipital bone. This jugular fossa has a notch here. This notch was called the glossopharyngeal notch. This notch has a canaliculus on it, and this canaliculus is called cochlear canaliculus. The lateral wall of the jugular fossa has the mastoid canaliculus, and between the jugular fossa and the carotid canal is the tympanic canaliculus. Then there is the styloid process. This styloid process, when viewed from the lateral side, is directed downwards, forwards, and medially. It is bound anteriorly by the tympanic plate of the temporal bone. This styloid process on its posterior margin, posterolaterally, has a foramen which is called stylomastoid foramen. The stylomastoid foramen is present between the styloid process and the mastoid process. Then there is the mastoid process, which is a breast-like or a thumb-like projection from the posterior part of the mastoid part of the temporal bone. Projects anteroinferiorly. This mastoid process on its posteromedial surface has a groove. This groove is called the mastoid notch. This mastoid notch houses the digastric muscle. Behind the mastoid notch is another groove. This groove is for the occipital artery.